Welcome back to the Post. Let's talk about this dangerous pandemic called COVID, because health experts have expressed worry as COVID fatalities in the country shoot up in the last 3 weeks. The current number of deaths from the pandemic stands at 930. The Ashanti region has seen its COVID-19 fatalities shoot up in the last 3 weeks with 47 new deaths. We'll bring you more on the deaths in the Ashanti region. But first, let's examine the current figures, and I'm joined via Zoom by head of our health desk, Fred Smith. Fred, what's our current situation looking like?
522 new infections in the latest report released by the Ghana Health Service, and these are for events on the 12th of August. It brings our active cases to 6,004. The deaths, as you mentioned, 930. We have severe and critical cases at 174. The COVID numbers, as at the 11th of August, the day before, are the deaths 922. So in between that, we have 8 additional deaths being recorded in a day. Severe and critical also standing at 174, just like we had on the 12th of August. Now, the concern is about the deaths. We can have a comparison of the 2 months up to the 12th of August. And if you do that comparison, we had 790 on the 12th of June. That's 2 months ago. And we now have 140 COVID deaths more if we currently are at the 930 that you mentioned. The number of severe and critical cases have also shot up to 152. On the 22nd, on June, we had 22 cases of severe and critical cases of COVID. And then on August 12th, it's gone up to 174. And this is why the Director General of the Ghana Health Service yesterday at the news conference mentioned that we are actually experiencing pressure on the health facilities because more and more persons are coming to the facilities with severe and critical cases, and the results of the deaths that we are seeing.
Fred Smith is head of our health desk, giving us some updates of the COVID situation in the country. We can now hear from the Director General of the Ghana Health Service, Dr. Kuma Boaje, on the pressure on our health facilities.
Our treatment centers, yes, there's a lot of pressure on our treatment centers, no doubt about that. But as people get discharged, spaces are created, and that Ashanti initially was bad. It's a bit improved, and so it may be good today, may be bad tomorrow. But that's the more reason why we want to ensure that people don't catch the virus, and also, no matter what you do, if we don't protect ourselves, all our beds will be full, and we don't even have enough health workers to manage them, because the health workers will also go home because they are exposed.
Let's go to the Ashanti region, because Ashanti region is recording increase in COVID-19 deaths, though infections are declining. And of course, the Ashanti region has seen its highest COVID-19 fatalities in 3 weeks with 47 new deaths. The number of deaths continue to be on the rise, increasing from 297 in July 25, on July 25 to 344 cumulative deaths. On August 16, 2021, Regional Health Director Dr. Emmanuel Kojo-Tinkran told a weekly COVID-19 media briefing the situation should worry the public of the dangers of the COVID-19, especially in heeding to adherence to safety protocols.
For the deaths, you can also look at what is happening in Greater Accra. Greater Accra is even worse. One thing is that there's something that we all need to understand, that COVID kills. And a lot of people, because they are not seeing the deaths in their homes, they think that the COVID can kill. But the situation in our hospitals is quite different from what those in public are seeing. When you come to our hospitals, we get cases of COVID all the time. And unfortunately, we lose some of them. And those we lose, we've lost those that have not been vaccinated, unfortunately. Those that were not vaccinated. In Ashanti, no. So you realize that if you are not vaccinated, you don't adhere to the protocols, and you get COVID-19, it can kill you. And from the data that you presented yourself, as at the second wave, our death was 299 or 96. Now we shot up to 344. It means that COVID kills, and it's killing not only in Ashanti, but also in all the other places. And throughout the world, I think it's well known. I believe that we've lost close to 4 million people from COVID globally, and Ghana is no exception. So that's the situation. And that is the message.
Let's speak with my colleague Ohimin Teria, who's been on the ground for us. Ohimin, we know that the Johnson & Johnson vaccination started last Friday. How is it going?
Ashanti region, 4 hotspot districts, and out of these 4 hotspot districts, we have 36 centers providing the vaccination to residents in these areas. The Regional Health Directorate is asking residents in these affected communities, which provides not less than 80% of COVID-19 cases in the region, to take advantage of the exercise and get vaccinated. He mentioned particularly that the new deaths of 47 being recorded between 25th July and today. Among them is a health worker who refused to be vaccinated. He says the person didn't take advantage of the vaccines at that time. And when he was got infected, he couldn't survive the COVID-19 pandemic. So Dr. Tim Kran is encouraging more people to be vaccinated. But one situation that is clear after I spoke to Dr. Tim Kran is that many people who were on the AstraZeneca dose continue to flood these centers to be vaccinated with the Johnson & Johnson. It's a situation that Dr. Tim Grant is not happy, and he's also asking people to desist from what he says could be a life-threatening situation. We can take a listen to Dr. Tim Grant.
Why I think we've had that report. Those who had the first dose of AstraZeneca are very anxious to get the second dose because they believe that the immunity will wane and that it will put them in a very big threat. But what we want to assure them from science is that when you take the AstraZeneca vaccine, at least when you wait for a period of about 6 months, even your immune system, when you get the second dose, is even better. So they shouldn't get scared at all because the government has made the necessary arrangements to get us the second dose. And definitely all of them will get the second dose. So all that we will tell them is that they should continue to exercise patience. So what we can assure them is that the second dose will definitely come. They will have it. So they should wait.
What more has the regional health director been saying with regards to contact tracing?
Yes, Aisha, the regional health director, Dr. Tim Grant, touched on the fact that there's been speculation, which has been rife recently, that health authorities have reneged. They've relaxed their efforts in testing and then tracing people who have been, relatives or friends have been affected. And he says that there's nothing of that sort. As far as the regional health directorate is concerned, they are now doing more and more scientific contact tracing than what they did. Initially, they were doing it on large scale. For instance, he says if somebody gets affected, at first they will come and then test all the people in that locality. But now they are not doing that. They have now diverted their attention to small spaces where these people live. For instance, if we live in a house, they will just concentrate on the household instead of going out to test the entire community. He says yes, contact tracing and then testing is still ongoing in the Ashanti region.
I think
we are doing more testing, we are doing more contact tracing, and that's the reason why we are getting the cases. In fact, if you are not testing and you are not doing contact tracing, you won't get any case. Yes. So the fact that you see us getting more cases and reporting more shows that the cases are being identified. And we identify all the cases through contact tracing. In fact, that is the only method that we use to identify the cases as at now. Previously, when it started, we were doing what we call the enhanced contact tracing. When we get a case, we just look at a certain radius and then go there and then test all the people there. That's quite different. We've moved to a different area now. What we are doing now is that when we get a case, we look at the contacts, the immediate contacts, and also test them. And I think from the second wave, that is what we've been doing throughout. So it's ongoing.
Ohime, what new strategies are they adopting to curb the increasing rate of infections?
Dr. Atinkran highlighted some of the efforts being made by health authorities in the region. For instance, he talked about the fact that the Ebola being identified in neighboring countries, and he says the strategy in combating these conditions, the hemorrhagic fevers, are not different from the one being used to combat COVID-19 in the region. So health authorities will stick to the COVID-19 plan, and as a result, the old Bekwai Government Hospital has been identified as a public health space that in the event of any outbreak of hemorrhagic fever, the case will be transferred to the particular space. Now, there are also efforts being made by the Regional Security Council to encourage more people to adhere to COVID-19 safety protocols. He says that is still being enhanced with more public sensitization effort being made to encourage the citizenry, especially with regards to the hand washing and then wearing of face masks, so that people will continue to be in that regard. Now, more health personnel are also being trained so that they are able to gather information as quick as possible on some of these conditions, for instance, COVID-19, and then the hemorrhagic fevers, in order to control them as quick as possible. And beyond this, it's also, as a regional health director, to continue to rely on the support of the media in the region. He commended the media in the region for a good work done. He says, has it not been the effort and the intervention of the media, the regional health directorates wouldn't have, managed to control the COVID outbreak in the region so quickly and perfectly. So he elaborated on a lot of measures and also encouraging the citizenry to support the effort of health officials in order to bring all these situations under control.
Ohime Nteria is a man in the Ashanti region monitoring the vaccination exercise and also telling a situation about COVID-19 in that region.